Hi, hello everyone. Welcome to Apothecary Tales, the basics of pharmacology. As informed, today onwards we'll be going to start with certain question discussions, and there will be different parts for this question discussion, and each part will be having 5 questions each. So today we'll start with part 1. So the first question is, which symptom is least likely in a patient with diabetes mellitus? First of all, we already know what are the different symptoms of diabetes mellitus. Diabetes mellitus symptoms would include feeling more thirsty like polydipsia, more urination, polyuria, weight loss, fatigue and weakness. So here we can see that there are 4 options: urinary retention, excessive thirst, glycosuria, weight loss. As mentioned just before, it mainly causes excess urination and not urinary retention. Therefore, the answer is urinary retention, option A. Moving on to the second question. Which condition is characterized by destruction of myelin sheath surrounding nerve axons? First of all, myelin sheath is an insulating layer or sheath that forms around the nerves, including those in the brain as well as in the spinal cord. So let's look into each options. First one is Huntington's chorea. This is basically a mutation in the gene for a protein called Huntington, and thereby this will lead to certain movement disorder. Moving on to the second option, multiple sclerosis, which is an autoimmune disorder which leads to the destruction of myelin sheath surrounding the nerve axons. Parkinson's disease, the third option, is nothing else but a nerve cell damage which will lead to the depletion of dopamine or increase in acetylcholine. The fourth option is tardive dyskinesia, which is basically a nervous system condition leading to repetitive involuntary movements, and this usually happens due to the long-term use of psychiatric drugs. Most of the time, the Parkinson's disease and tardive dyskinesia is usually misunderstood. So here, Parkinson's disease usually happens immediately with the use of certain antipsychotic drugs, whereas tardive dyskinesia usually happens after long-term use of the psychiatric condition. So among these options, definitely as discussed, the condition that is characterized by destruction of myelin sheath surrounding the nerve axons is multiple sclerosis. Moving on to the third question. Which one of the following drugs is least likely to need a dosage adjustment in a patient with reduced renal function? The options are haloperidol, metformin, digoxin, tobramycin. So let me first talk about metformin. We know that metformin usually causes lactic acidosis, and this usually increases when a person is having renal impairment. So it is not contraindicated in renal impaired patients, but it is necessary to have a renal dose adjustment. Second, digoxin. Usually, digoxin and digitoxin is the cardiac glycosides. Digoxin is mainly eliminated from the body via kidneys, whereas digitoxin is mainly eliminated via the liver. So therefore, as per the option given here, digoxin definitely is influenced or should be altered in renal impaired patient because of its renal clearance. The last option is tobramycin. We know it is an antibiotic belonging to the class of aminoglycosides, and they have potent nephrotoxic and ototoxic action. So therefore, it is necessary that we should avoid this aminoglycosides in renal impaired patients. Now, the last option we are talking about is haloperidol. Haloperidol, less than 1% of this medication is excreted unchanged to the urine. So, when we compare all the options, haloperidol, metformin, digoxin and tobramycin, let's go back to the question and see what would be the apt answer. The question once again, which one of the following drugs is least likely to need a dosage adjustment? Metformin, digoxin, tobramycin, yes, requires renal dose adjustment, whereas haloperidol is not influenced by renal impairment. Therefore, the answer is option A, haloperidol. Next, fourth question. Where are alpha-1 adrenoreceptors primarily located? We We know that adrenergic receptors are basically alpha and beta. Among that, alpha 1 receptors are predominantly present in arterioles, veins, internal sphincters, iris, dilator muscle. So among the options given here, the options are arterioles, bronchioles, atria, cardiac ventricles. The correct answer is arterioles. And finally, the last question from this part is, which compound is an irreversible cholinesterase inhibitor? The options given here are physostigmine, pilocarpine, malathion, atropine. Let's discuss each drug. Physostigmine is an indirect acting cholinergic agonist, that is anticholinesterase agent which is reversible in nature. Whereas pilocarpine is a direct acting cholinergic agonist. Atropine is antimuscarinic agent. Finally, malathion is an anticholinesterase agent which is irreversible. So the question once again here is irreversible cholinesterase inhibitor. So being irreversible, and it should block the action of cholinesterase. So among the options given here, it is malathion. So with that, we wind up the first part of question discussion. I hope it's clear. We'll be meeting in the next part of question discussion. Thank you.